I'm Dr. Matthew Robbins. I work at the Montefiore Headache Center and the Albert Einstein College of Medicine in the Bronx, New York. Probably three most common procedures. The first are what we call nerve blocks, which the more scientific phrase would be peripheral nerve blocks. The second is botulinum toxin injections, which are done in the head and neck and shoulders. And the third are trigger point injections, which are injections given into different muscles on the scalp, neck, and shoulders. For people with chronic migraine, all of these procedures could be used to treat them. The good news is the only approved treatment by the FDA in the United States to treat chronic migraine are botulinum toxin injections, which actually work for chronic migraine, but not people who have migraine that is less frequent. So that is a group of people who can respond specifically to this treatment. Nerve blocks can also be used to treat chronic migraine specifically, and they can be used in two different ways. One is to treat a bad migraine attack that doesn't stop by other means like medications or injections or other such treatments. And nerve blocks can also work to treat people with chronic migraine by being what we would call a short-term preventative treatment or a bridge treatment. So this is a treatment that might last on the order of several days to weeks, and it might be used when someone is in a bad migraine cycle that will help someone while a preventative treatment is initiated that takes longer time to start working. So certain headache procedures can benefit people with different headache disorders. Where there's the strongest level of scientific evidence is for people with cluster headache. So people with cluster headache can respond quite well to an injection in the occipital area in the back of the head with a steroid that can serve as a short-term treatment to get their cluster headache attacks under control while a daily medicine is started and takes time to start kicking in. And this has been proven in different studies and is something that's a great alternative to what had been used more frequently in the past, which are oral steroids like prednisone, which have many more side effects. So an injection like this has good scientific evidence and has very few side effects, so many patients would prefer this approach, and the scientific evidence backs it as an effective treatment, especially for people with cluster headache. But other treatments work well for other disorders. For example, nerve blocks work well for people with migraine and chronic migraine and other headache disorders and have scientific evidence that suggests it. And trigger point injections can work for people who have all of these headache disorders, but maybe particularly for someone who has frequent tension type headache attacks. Botulinum toxin injections, which are known as Botox because that's the brand name for the medicine injected, are a proven effective treatment with safety for people with chronic migraine. And botulinum toxin injections are given every 3 months in a series that includes upwards of 30 to 40 injections with each series, but they're a very safe treatment to use. Each injection is a very small volume with a very tiny needle, which is typical for what might be used in acupuncture, and is generally quite well tolerated. And it's something that is done increasingly more by headache specialists, neurologists, and others who treat people with headache in the United States. It is very safe and tolerated quite well by many people, and it's a great alternative or treatment to use in the first place instead of some of the more traditional oral daily medicines that have been prescribed in the past many decades. There are other procedures that are under investigation or have been used to treat people with headache disorders. The one that has received a lot of attention in recent years are something called sphenopalatine ganglion blocks, or SPG blocks, as they're known by abbreviation. And these have been studied to treat migraine, chronic migraine, cluster headache, and other disorders. The traditional way that this treatment has been used is to use a cotton swab or a long Q-tip and have it dipped in an anesthetic like lidocaine, which is similar to what a dentist would inject for local anesthesia, and put it all the way in the back of the nose to try to reach this SPG structure that is very important in pain generation and processing. And newer devices have come out to make the administration of this block more tolerable to patients. These catheters that don't look as ugly as a long cotton swab that are more tolerable. Whether they work for headache disorders is not totally clear, but in many studies there's the suggestion of benefit, and they certainly seem to be quite safe in people who don't have any major sinus or nasal problem.